80% of adults have some form of gum disease, and most don't even know it. Many patients...
Our nation can only be as strong as our health, and we're not doing well now. We have twice the chronic disease of Europe and 4 times that of Mexico, Japan, China, and India. 75% of our medical costs are caused by chronic disease by things that we can prevent. We know how to prevent 75% of chronic disease right now, but we don't do it. The gap between our knowledge, that technology, and our increase in medical costs grows, and because of that, we're now at a much worse point. Only if America stops the influx of chronic disease, only if each individual stops their own chronic disease, can we lead in healthcare, and can America be a vibrant country with a high standard of living.
To have true healthcare reform and not health financing reform, we really need to help people create health. The reason for the spiraling healthcare cost is not because of irresponsible insurance companies. The healthcare costs are rising because we've got a lot of unhealthy people. To cause a clot and block. I'm currently on the board of directors of the American Academy of Private Physicians, and through this organization, I've been introduced to many innovative technologies, many innovative testings that are going to really impact my patients' lives and implement into what I now consider a third era of medicine practice. The first era of medicine was the beginning of time. That was the era where our main focus as health providers, didn't have a lot of tools at that time, was to battle infectious diseases. That's what killed people. So once we had improved public health, once we had antibiotics, once Elvis got his measles immunization in 1958, we transitioned to the second era. It's the era of combating chronic diseases. We started getting terrific heart surgeries, started to be able to identify and treat cancers. And throughout the last 50 years, the amount of technology, medicines, treatment options have been fabulous to, once we find the disease, and fix it. So the mindset of every physician in the country is finding the disease and fixing it. And the third era needs to be a new mindset among all health professions to participate to help our patients create health and have more good years. Within creation of health, we're helping to take a person who is not yet sick, has not developed a problem, and prevent them from ever going down the path to sustaining that illness. So as I'm identifying patients with disease, I would have a subset of patients who I couldn't find a cause for the problem. Well, then when I discovered the amazingly strong association between mouth disease and the things that I do treat, like blood pressure, diabetes, heart attacks and strokes, even things like pneumonia, and a whole long list of systemic diseases that can originate from disease in our mouth, that was another turning point in my career. Once I looked inside the mouth, I found the source of a lot of problems in people who otherwise might not have had their problems identified.
The mouth. It is such an important part of the human body, yet often overlooked when we think about our overall health.
The mouth and the rest of the body relate anatomically and functionally, and that's why the oral systemic connection is absolutely inherent in the way we're put together. So the mouth shares the same communication systems with the rest of the body. But then the mouth itself has some key physiologic functions that make it essential for our health and well-being. We eat through our mouths, we breathe through our mouths, we protect ourselves through our mouths, we have sensation through our mouths, we have immunity through our mouths. So all of the basic body functions that keep us going on a day-to-day basis involve primary functions through the oral cavity.
It also plays a key role in our social interactions with people. I am horrified by a young person who has a bad smile, and I'm talking badly decayed, because they're never going to get that front row job. They're always going to be delegated to the back, and that's if they do get a job. So the mouth is a very important place.
There's a connection. The body is connected. Whoever made this fantastic thing called the body was quite genius in that it is connected from head to toe.
From a disease standpoint, when we have different situations in the mouth, we respond, our body responds with inflammation, and that's where we start the inflammatory cascade that's affecting most of these inflammatory diseases. I want you to think about this. Inflammation, and there's a concept called inflammatory burden. When you get more inflammation in your system, the accumulation of that will have a tipping point where you tend to have inflammatory disease. Inflammatory diseases are heart attacks, strokes, diabetes, rheumatoid arthritis, various cancers, kidney disease, pancreatic cancer. The list goes on and on and on.
We're in a state of chronic inflammation, and that's the basis for every disease that everyone has. It's the basis for cardiovascular disease. It's the basis for cancer. When you're dealing with periodontal disease, there's this entire inflammatory cascade going on that people don't understand. When you get a cut, for example, okay, your body is set up to heal that cut, and that goes through a process of inflammatory response to solve the problem and resolve. If you always have a chronic inflammatory bacterial condition in your mouth, then you never turn off that process of inflammation. In other words, it never gets the opportunity to resolve and go away. There's just too much. The body can't react to all of them, and the body gets sick.
Periodontal disease, periodontitis, gum disease, whatever you call it, it all begins with bacteria. Bacteria are microscopic organisms, and in your mouth, there are billions. Over time, these bacteria can stick together and multiply over and over again. They can then form a colony and join together to create a thick layer called a plaque biofilm. Then, over a short period of time, it can dramatically spread throughout all of your mouth, teeth, gums, tongue, cheeks, everywhere. If there's an opening in your bloodstream in your mouth, the harmful bacteria can enter, causing the body many sicknesses. But there is another problem that occurs in response to the bacteria as your body tries to fight back. Inflammatory cells are triggered to try and kill the bacteria. But bacteria build their own strong defenses and battle back. This microscopic war ensues, and the result? Chronic inflammation. And inflammation is the basis for so many diseases.
The population of the planet is 7 billion. A nickel, the volume of a U.S. nickel is a cc. A cc of spit has more bacteria than the population of Earth. It's got about 8 billion bacteria and a nickel's worth of saliva.
So bacteria is basically a foreign organism that comes into our body and attacks our body and causes disease. And that can be picked up from a door handle, or I've, strangely enough, had a couple of patients who have had periodontal disease transmission from their dogs, from feeding them treats and not washing their hands afterwards and eating, or letting their dogs kiss them. So when you were growing up and your mom would say, don't drink after your brother, or, don't share that popsicle with your friend down the street, you're gonna get germs, or go wash your hands, you were just outside and you might have germs. Those germs are the bacteria that then can go into your mouth and set up infection.
So we say to the dental patient, you have an infection in your gums. The total area of your gums is about the size of the palm of your hand. If you looked at the palm of your hand and you saw an open wound the size of the palm of your hand, would you just decide not to do anything about it? And yet people are choosing every day not to address the infection in their mouths. People think that it's normal that when they brush their teeth, their gums bleed. And I don't know where they came up with that.
If there's a little blood in the sink, it means they've got a problem. The bacteria that cause inflammation in the mouth will typically cause inflammation in the rest of the body. Yet if there's a little inflammation between the teeth, it means that there's a problem where those high-risk bacteria may be getting into their bloodstream and cause any one of the many systemic diseases that can originate from bacteria in the mouth.
I'd like to stand back and realize that there's some untreated inflammation here and look at the root cause. And 10 years ago, I found a gentleman by the name of Dr. Bradley Bale who was doing family practice in Spokane, but had been kind of taking a special focus on disease, vascular disease, versus just general family practice. So we joined forces at that point. I worked with him in family practice, and then in about 2001, 2002, we decided to close the family practice and spend 100% of our efforts on vascular health. And the reason we did that is because so many people are told they are fine based on their risk factor profile, based on their age, their gender, and all of those risks, and they are harboring silent vascular disease. And the reality is, it's the vascular disease coupled with inflammation that really causes events. And that's really where the Bale-Donine method got going and started, is that we are doing something different. Rather than focusing on a risk factor paradigm, we're focused on a disease treatment paradigm. How was your last dental checkup? When patients come in, sometimes they're surprised when I really dig deep into their oral health, and I talk to them about what their dentist says when they come in. I ask them if they floss, and if they don't, I ask why. And it's a great conversation to have because it allows me to demonstrate that the oral cavity has systemic impact.
We've always had a keen interest in the health of the mouth in our work to prevent heart attacks and strokes, and that is just intensified as the science has evolved. We now have great science telling us that the cause of arterial disease is inflammation, and another source of arterial inflammation is infection in the mouth. With the most recent study coming out, it actually implies up to 50% or more of acute heart attacks are triggered by oral infection. That's huge. Heart attacks are the #1 killer in this country. Strokes are the #1 cause of disability. The current cost of cardiovascular disease to our healthcare system is about $518 billion. And it's all preventable. And about 4 years ago, we felt our method, which we call the Bale-Donine method, had evolved to a point where we could actually guarantee our work. So that means the patients that I personally treat, if they were to suffer a heart attack or an ischemic stroke, the fees they paid to me for my service that year I would refund. So we get extremely high-risk patients, which is fine. I like a challenging patient, and I do believe you can shut down the disease process in anybody.
Julie is a patient of mine that I met, unfortunately, after she had a heart attack. She actually had 2 heart attacks, believe it or not, at the age of 37.
I was getting ready for work one morning and probably running a little later than I wanted to. So I was getting ready, and I remember feeling rushed or being rushed, but the feeling was all in here, and then it just kept compounding, and this heaviness, I wasn't breathing deep, a heaviness was just resting on my chest, and I couldn't make it go away, and I couldn't feel better.
Julie went in with chest discomfort. They told her she had pneumonia. And she said, well, I don't even have a cough. How could I have pneumonia? And they said, well, take this antibiotic and let us know how you feel in a few days. So the next day, same thing, the chest pressure is worse. So she goes in, and this was just last year. This isn't in 1957, this is in 2012 in a metropolitan city. She goes in again, and it wasn't till her second visit that they finally determined that indeed this poor 37-year-old mother of a 3-year-old daughter is having a heart attack. So she's treated now for her vascular disease, but when she first came in to see me, the tears and the issue were not because of pain, it was because of fear. She had no idea why on earth she had a heart attack. Why would she? She's a beautiful, fit, healthy 37-year-old mother of a toddler that says she's been told she's healthy her whole entire life. Why on earth did she have a heart attack? And so with the knowledge that we have of what causes vascular disease, it was with that education and that knowledge that Julie finally understands what caused her vascular disease, and we're treating that, and we're measuring the inflammation to know that our treatment is working, so she can proceed with life in confidence to know that that won't happen again. Most recently, however, I was doing Julie's inflammatory labs, and all of a sudden I saw a spike. Some inflammatory labs can be thrown off if you stub your toe, if you have a sore throat. This one really means something. It's a player in the disease state. So when this lab value is elevated, it tells me objectively that something is starting to tread on our territory of vascular stability. So that's when I pulled Julie in the office and I said, gosh, do you have anything inflammatory going on?
She said, this inflammation has got to be coming from somewhere. What is going on inside of you? She said, are you sick? Did you sprain an ankle? Anything? And I said, no, nothing. And she said, do you have a tooth that's bothering you? And I said, yes. Yes, I do.
And I said, well, let's investigate that further. Let's go back to your dentist and let me call your dentist. So that's indeed what I did, and we talked, and I said, this inflammation is being driven by something other than the common vascular risk factors that I'm treating for Julie. Can you please look a little deeper into that tooth that's been bugging her? Sent her to an endodontist who ended up doing a